So good afternoon, everyone. Thank you all so much for coming. We are very happy to hold this briefing today. Of course, want to thank our congressional sponsors. Senator Tom Harkin was happy to help us get this room on the Senate side. Our Congressional Study Group on Public Health, currently run by Congresswoman Lucille Roybal-Allard and Congressman Jim McGovern, also very helpful in getting the word out on the House side about this event. Congressman Cassidy's staff, also very, very helpful in organizing this event today, and I'm very honored that he has come to join us this afternoon. I think with that, I'll introduce Congressman Cassidy, who's very kind to join us, and then we'll turn it over to the panel.
Thank you, Carl, for having me, and I'm very pleased to participate in that. As it turns out, I'm a physician. My laugh line, which some of you have heard too many times, is that I'm a gastroenterologist, and gastroenterology prepare me very well for Washington, D.C. But in reality, although a gastroenterologist, I always consider myself more a public health doctor, and so I'm very familiar with what CDC does from having worked with CDC as a public health doctor. And our first vaccine program in Baton Rouge was co-sponsored, if you will, or at least technical assistance was given by CDC, a program that ultimately led us to vaccinate 36,000 children in a 10-parish area using CDC resources that have been at no cost to the children, to the schools, to the parents, etc. So again, I am so aware of what you do. Now, part of what you do, obviously, is this, and I also thank you for that. The old public health maxim, if something is not measured, it is not addressed. If it is, it is. You are those who measure. And so as I look at your statistics, for example, on obesity, you're helping to shape not only this offering of snacks back there, which is heavy on fruit and light on cookies, but also public policy responses to something which we see as a harbinger of an epidemic of diabetes, cholesterol, heart disease, stroke, fatty liver, etc. So what you do is truly an incredible service to our country. Lastly, I will thank you for having this meeting, because stats by themselves can be a tree falling in a forest where there is no one to listen. It can just be something that collapses and really it has no impact. If you publicize, it has an impact. So I thank you as well, gentlemen and ladies who participated in this, for publicizing. Because without informing public policy with these sort of public health facts, our public policy is misguided, oftentimes even misled. With your public health facts, our public policy is more likely to be guided and accurately led. That said, thank you again for having me. Appreciate it. Thank you, Jimmy. Thanks, Tom. Thank you.